So now what we're gonna do is we're gonna talk about 4 different knee symptoms that are common and the taping around the different issues. So most people don't know the basic anatomy, the fancy names sometimes. So I like to make this for, everybody that's at home and everybody, therapists and docs that are doing this in the office. So we've got a patella tracking syndrome, right? We've got just the patella, maybe an Osgood-Schlatter's, a flare and it's not just children, right? It's seen often where the patella and the ligament are attaching to the bony prominence in here. We've got the medial collateral, maybe they've got a sprain of the knee, the lateral collateral. Again, these are the fancy names, right? But patients and people just present with knee pain. So if you want to, taping helps. It doesn't heal, but it does help. So taping people with these, even just knee swelling, maybe they've had surgery or they're going to need surgery, and you're just basically taping them to give them more comfort, not maybe healing and full 100% removal of symptoms, but giving them more comfort. And really the tape helps really well with, lower extremity issues because of gravity wanting to hold swelling, especially in these knee joints. So moving right along, I've cut up a lot of pieces of tape because we're gonna do different symptoms on this knee and then different symptoms on this knee. So one of the ones I wanna start with is the patella tracking syndrome. And if you've identified it as such and you know it's that, then this works really well for that. Typically it's just 2 pieces of tape, about 4 squares pre-cut, depending on what you have. You can, before taking the tape off, you could lay it over the patella or the kneecap and then just kind of find the kneecap, bend this in half and cut. That's about 1.5 inches. We've got this opening like this. So I'm just gonna start with one end past the opening. We're gonna anchor it down here at the bottom. Pull that across like that. Pull it back. See how it stuck to itself? Just give it a little pop. And let's anchor that underneath the knee. You can see here, you can go all the way across if you want. Take your time. This one's gonna be a little bit more challenging for some. You can see I'm just following the contour of the kneecap. And then I'm gonna have this like this, and then I'm gonna have you bend your knee. I'll keep bending, 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 good. And then you can lay that flat again. Perfect. So I did not pull and create tension on here. The bending of the knee created more tension, and then we attached it. This piece here, you can do one here, you can do one here. That typically works really well. If you only had 2 pieces, you can just do one. This one, I would do the bottom. That's a personal preference. Tear, twist and tear, slight pull, apply tension. There's the bottom of that kneecap right there. I can feel it. You can move it, you can feel it, it's right there. Half there, half off. Come around, and then we can do one at the top. But this one's gonna go basically here. I know the top of the kneecap's here, so we're gonna keep that through there. Slight tension, not 100%, maybe 50. Anchor, release, anchor, release. So this typically works pretty good for patella tracking. Now what we're gonna do with the lateral one, or the other knee is we're gonna do a discomfort where the symptom is on the outside, and then we'll do one where the symptom's on the inside. Now, I've done this different ways where the patient has said it would really help. Instead of just this, I've done this. So if the discomfort was here, it was holding some swelling in here, I've come across and did an X. And then the same thing would happen. And so if you're not sure, well, they're gonna tell you, you know, but if you're like, okay, well, where's the knee joint? You know, you can feel it if you know what you're palpating. But typically the patient will point, oh, it's really bugging me right here. Or they're holding a lot of swelling. Again, you can do that for the medial. So I'll show you the lateral, and the patient is presenting with discomfort by this landmark here. So eyeball it, say that's where this first one's gonna go. Slight tear, release the backing a little bit, give it a good tug. I got about a 50% pull. I'm just slowly attaching one end, guiding, no pull, guidance there. Before releasing the backing, I'm eyeballing this. I'm gonna do a twist, tear, release. Giving it 50% pull, and then releasing it. I know some people, like, you will think that you need to bend the knee with this. You do not have to. There's more stretch in the knee here, bending, and much less here. And that's different ways to tape the knee.